Now it's time to start talking about the Clostridium genus of gram-positive bacillus pathogens. The first Clostridium we're going to talk about are Clostridium perfringens. So Clostridium perfringens causes two different diseases. If the bacteria or the endospore is introduced through a wound, into the muscles, it can cause gas gangrene, which is a severe life-threatening disease. Or if the endospores are introduced orally and by ingestion, it can cause Clostridial gastroenteritis, which is just a mild food poisoning. So this is an example of how two different introduction routes can have such a big difference, Either by a wound or by ingestion can be very different. So let's first talk about gas gangrene or myonecrosis. So how this works is usually there's some spores in the environment and somebody gets a deep wound. So this could be maybe for example, a gunshot wound. We've seen gas gangrene during times of war. Or if somebody has a surgery with improperly sterilized equipment and there's endospores on that, so surgical route. Or if somebody has a diabetic ulcer, this could put them at risk for gas gangrene. These days, obviously, we don't see that many gunshot wounds, hopefully, but what we've been seeing more and more of is gas gangrene through intravenous drug use. So because of the drug use epidemic we have in this country, we're seeing more and more people use unsterilized needles, and we see these deep wound infections from IV drug use. Clostridium perfringens has several virulence factors. It releases an exotoxin called alpha toxin, which causes red blood cell rupture, edema or swelling, and really destroys the tissues. It also releases some enzymes. These are all enzymes here that destroy tissues, like collagenase, which destroys collagen, hyaluronidase, which destroys connective tissue. And basically what happens is when the bacteria is localized somewhere like in the foot of a diabetic patient, so if we see a localized infection, the bacteria might start, now Clostridium are anaerobic and they're fermenters. And when they ferment, they release gas. So what you see is a buildup. You'll see swelling, and it's actually gas that's building up in the tissue. So you'll see this death of the muscle tissue where the infection is, and you'll see gas buildup. If the infection is very, very deep into the muscle, it can lead to a more severe form of the disease called myonecrosis, which is basically death of the muscle tissue. And all of the bacteria will basically kill off the muscle, and you'll see severe gas formation, pus, fermentation. And if it gets to be to this point, and it's so bad, the really only thing we could do is really amputate the site of the infection. It's often an arm or a leg, and so amputation may be needed. Or in the case of a diabetic, it could be part of the foot. Other ways we can treat gas gangrene. Obviously, immediately if there's a wound, we will clean the wound very thoroughly. Debridement of any infected tissue, which means we remove the site of the infected tissue. Hopefully, it's not a full-on amputation. Now, another thing we can do is because Clostridium are strict anaerobes, we could place the patient into a hyperbaric oxygen chamber, which basically just shoots oxygen at the site of the infection to help kill off any bacteria that are still there. Large doses of antibiotics such as cephalosporin or penicillin may be effective at killing the vegetative cells. There's no vaccine for Clostridium perfringens, but luckily it's pretty rare in the United States. Now, like I mentioned, the second disease Clostridium perfringens causes is Clostridial gastroenteritis. This is basically just a mild food intoxication. So basically what that means is the bacteria have been growing on the food. They release a toxin onto the food, and then somebody ingests that toxin. And it basically will cause diarrhea, nausea, vomiting. Usually a person will recover rapidly. This is another example of one of those 24-hour kind of stomach bugs. The second Clostridium we're going to talk about is Clostridium tetani. So once again, this is the organism's name. Clostridium is the genus, tetani is the species. The disease that Clostridium tetani causes is called tetanus. Tetanus is the name of the disease, and you might have also heard of it being called lockjaw. So here's what happens with Clostridium tetani. Clostridium tetani spores, their endospores, are everywhere in the environment. They're outside in the dirt. They're laying on surfaces, all right? And again, the Clostridium is strictly anaerobic, so the spores need to enter into a deep wound in order to germinate and grow. And the only way the endospore can really get into the body is if something actually penetrates through the skin layers into the tissue. So something like stepping on a rusty nail that you might have heard of before, or if there's broken glass that enters deep into the tissue. I've actually heard a story of somebody that was wearing a soccer cleat, and the sharp spikes of the cleat got stuck into their leg, and there was tetanus spores there, okay? So once the spores enter the body, then they can germinate and turn into active vegetative cells. Clostridium tetani releases an exotoxin called titanospasmin. So titanospasmin is the name of the exotoxin produced by Clostridium tetani. Titanospasmin is a neurotoxin. So it acts at the neuromuscular junction. And what it does is it causes permanent muscle contraction. So the muscles cannot relax. They stay stiff. And that's why they often call it lockjaw, because one of the first signs is that the mouth almost has this permanent grin because the patient can't relax their jaw. Now, the most dangerous part about this is a person, when their muscles are contracted, they can't breathe. They can't relax those respiratory muscles, and they become paralyzed. And that's often what causes death, is the respiratory impairment. Luckily, we don't see a lot of tetanus because we do have now that preventative vaccine, DTaP vaccine. And we get DTaP from a young age, childhood. And then we're supposed to get boosters of it about every 10 years. The main places we see tetanus are in geriatric patients, older individuals, who may have not been following up with their DTaP vaccines, which often happens as people get older. They stop following up with the vaccines. This is another disease we see commonly in IV drug users, because another way for the spores to get introduced into the body is through that intravenous needle that's not sterilized. The most common place we see tetanus is neonatal tetanus, which means a brand newborn baby who has not been vaccinated. There are some cultures that practice rubbing cow dung on the umbilical cord, and this is just a cultural practice, but they actually found that this is a really good way to introduce spores into the newborn baby. So unfortunately, there's a really high risk of infection with that. In addition to that DTaP preventative vaccine, there's also a tetanus antitoxin, which is basically an injection of passive antibodies. And these antibodies will bind specifically to the titanospasmin and prevent the titanospasmin from acting on the neuromuscular junction. What's really important is that this antitoxin needs to be given before the toxin has time to really act. So the minute somebody steps on a rusty nail, or there's an accident, car accident, whatever, this antitoxin needs to be given immediately. As soon as the titanospasmin has time to act on the neuromuscular junction, it's too late. that can't be reversed. So this antitoxin it's so important that it's given immediately.